Myopia, short-sightedness, has increased a lot in the past decade. By 2050, it's estimated that more than half of the world's population will have myopia. It's particularly a problem for kids. In fact, according to the World Health Organization, myopia among children is on track to become an epidemic.
With screens now part of our everyday life, our eyes are feeling the impact, and for kids it's affecting their behaviour and their schooling. For more on this, we're joined now by optometrist Dr. Oliver Wu in the studio. Thanks for coming in this morning.
Good morning.
Just tell us a bit more about what myopia exactly is.
Myopia is a condition of the eyes. The eyeball a bit more longer, so the focus is in front of the retina, so musically they can see things far away, but they can see close up comfortably.
Mm-hmm.
Do we know why it's increasing in children?
Nowadays, a lot of kids spend a lot more time in all the electronic devices, spend more indoor than outdoor. Probably also the parents' expectations in the schooling as well, like OC class, selective school.
Well,
we noticed that.
What is it about that sort of behaviour that causes myopia? Is it the fact that you're constantly looking at something that's up close, or is it the fact that the screens are bright?
Probably the stress in the close-up and less outdoor activities, because we know the sunlight, this ultraviolet, the sunlight, is good for the myopia. We slow down the progressions of the eyeball size, and when the eyeball size is more stable, so people will become less short-sighted.
Is it also partly linked to genetics, and are some people more susceptible than others?
Yeah, definitely, especially in the Asians background people. Like you probably notice more Asians people are more short-sighted than the Caucasians. If a family of the father's short-sighted, the kids increase the risk for becoming myopia double. So both parents are high myopia. Probably you're talking about 5 to 6 times more, their kids would become more myopic.
And if you are short-sighted, then is treating it and getting glasses or contact lenses and so on, is that simply good for you in terms of how you can see, or does it have long-term health consequences in terms of helping your eyes down the track?
So now, basically, we look at glasses or contact lenses to help a person to see clearer, better. So we also help them to, like the kids, perform better in the schooling, academic, and also in sport. But we want to use some better options nowadays available in glasses or some special contact lenses to slow down the myopia by slowing down the eyeball size growth.
Yeah, what are some of those better options? How do they work?
I mean, the options, isn't it? We got some special glasses, like specifically for myopia control glasses, and some contact lenses, daytime and nighttime. So the more latest design, like some daily disposable soft lenses, are really great for young kids because they're safe. Daily disposable lenses are really great and safe.
And when you say nighttime contact lenses, do you mean that some people would wear contact lenses to bed?
Yeah, the special lenses called Orthokeratology. So basically, you wear the lens at nighttime, and you remove the lenses in the daytime. So you basically can see perfectly clean during the day.
Without any lenses or glasses?
Yeah, no glasses, no contact lenses.
What are the contact lenses doing while you sleep that they're able to achieve that?
What we call is Orthokeratology, like a corneal reshaping contact lenses, they reshape your cornea. So a lot of studies support that this type of lenses can slow down the myopia, both the corrections and also what we call axial link changes, like the eyesight changes.
When you talk about screens having an impact here, what sort of changes need to be introduced for kids in particular? What's the limit? Because obviously screens are a part of, even in schools, kids are using screens.
Yeah,
so
now,
what's the limit?
yeah, now a lot of schools from kindergarten are already using all the tablets. So we recommend the kids to have more time in between, like for example, 20 minutes. I always suggest 20 minutes, 5 minutes. To a bit more longer time to have them a break.
At a time, you mean?
Yeah.
Right.
So I like my 2 daughters. I mean, I don't mind for them to do 1 hour work, but they have to break them down into 3 segments, like 20 minutes, have a break, and 20 minutes, have a break.
Go outside and get some sunlight in between, maybe.
Yeah. Plus, I think the best thing is probably family time together outdoor, not just tell the kid go out. Family time together.
You've got to
probably
go out
best
too.
thing. Yes, that's the best things for family time.
Where does laser surgery fit into all of this?
Laser surgery probably is when you become an adult, okay, to help you to correct the visions. I mean, your corrections pretty much like permanently, and then you help you to see things better without any glasses or contact lenses at all.
But that is a cure for myopia specifically?
It's not really a cure for myopia. It's probably correcting your corrections, yeah. But we want to do something what we call early interventions, because we know the earlier we intervene the myopia progressions, the highest chance that we can slow down the eyeball size growth. When we can slow down eyeball size growth, we will minimize the risk a person, who myopic person will face in future. For example, like cataract, glaucoma, retinal detachment, or the macular disease due to high myopia. Like some people like me, I'm -50. So if Joe or Josh, you're -6, the chance for you to have cataract or like a glaucoma probably about 15, 20 times more than me. So yeah, we try to slow down the myopia as soon as possible and early as possible.
Dr. Wu, thanks so much for joining us.
Thank you.
Great to talk to you.